Long-term addiction treatments and their outcomes. Quitting an addiction is not an easy feat, so when you plan to begin a rehabilitation program for alcoholism or drug treatment, you will notice that there are many questions to ask and options to choose from. One crucial question to ask at the treatment facility is how long the treatment will last. The length and type of treatments are usually determined by the severity or medical necessity of the patient's illness. It may be long-term residential treatment, intensive outpatient program, short-term residential treatment, or 30 to 90-day residential treatment. What is long-term residential treatment in Fort Lauderdale, FL? Long-term residential treatment is a rehab program that requires the patient to reside in a treatment facility for at least 3 to 12 months and be placed under 24-hour care during the initial levels of care. The treatment begins with detoxification as the first level of care. This is a perilous stage, and staff must observe the patients at all times. Afterward, the patient is introduced to therapy that will match that specific level of care. When the inpatient treatment is completed, an aftercare plan will occur. What is the long-term addiction treatment process? The treatment starts with the detox process, where the patient has stopped taking drugs or drinking alcohol. The patient will be medically supervised and receive care. Medication-assisted detox and drug replacement therapy will take place. These treatments are medically managed to prevent severe withdrawal symptoms. Simultaneously, the patient's body physiologically adjusts to operating without the use of the alcohol or drug it relied on. Detox is the first stage of treatment, and the process will take several days, depending on the severity, substance used, and the length of the addiction. The patient is then placed on a program within the facility because detox alone does not guarantee lasting recovery. Therefore, additional treatment is needed. Most addicts are instructed to continue therapy as part of the treatment process.